Welcome to the Joint Surgery Center at Robert Wood Johnson University Hospital, Somerset. Our Joint Surgery Center has been nationally recognized for our outstanding patient outcomes, earning the Joint Commission's Gold Seal of Approval for total hip and total knee replacement surgery.
How's your pain today?
Maybe 5, 6.
Okay, well, it's that time of day. It's time to go to therapy, okay? So we're gonna walk you down.
What sets our program apart is our team approach that is centered all around you. Our team is dedicated to getting you back to your normal activities as quickly as possible.
On the day of your surgery, one of the first people you'll meet will be your anesthesiologist, and they will explain to you all about the anesthesia that you'll receive. Most of our patients receive spinal anesthesia with a twilight sleep, the kind you get during a colonoscopy. You'll be able to eat, drink, walk, and go to the bathroom after you wake up from surgery.
Our orthopedic surgeons have extensive experience performing total hip and total knee replacement surgery, including anterior hip replacement. We have standardized our patient care protocols for all joint replacement surgeries to ensure that we are all following the best surgical practices. This standardized approach helps reduce complications and provide the best patient outcomes. We work side by side with a dedicated OR nursing team that specializes in the care of joint surgery patients.
As the patient liaison in the OR, I will meet with your family members in the surgical waiting area and keep them updated about your surgery and recovery. After your surgery, your surgeon will either meet with your family in the waiting room or will call them. Each patient recovers differently. Your time in the recovery room with a bedside nurse will be somewhere between 1.5 to 4 hours. Your family members will be reunited with you when you move to your inpatient room.
Hi, Ed.
Hi.
How are you this morning? From the Post-Anesthesia Care unit, you will be brought to the John and Mary Obzanski Pavilion, which has 13 private rooms dedicated to our joint surgery patients. Each room has a private bathroom, flat-screen TV, phone, refrigerator, and accommodations for overnight guests. Our nursing staff is specially trained in caring for patients who have had joint replacement surgery and will be working with you to prevent falls, infections, and complications from your surgery, such as blood clots.
With any type of surgery, pain is a normal part of the recovery process. An anesthesiologist will be available to you 24/7 to help you manage your pain. We try to avoid using narcotic opioids whenever possible because these have many negative side effects. Instead, we use continuous nerve blocks and multimodal analgesia, which is the use of several classes of medications for controlling your pain. Our goal is to help minimize your pain so you can get up and start moving soon after your surgery.
Starting on the day of your surgery, an occupational or physical therapist will be getting you up and out of bed to begin your rehabilitation. We will track your progress on the walking board on our unit. We encourage you to bring a friend or family member to serve as your coach during your daily rehab sessions so that they can continue to help you with your exercises after you go home. Most of our patients are able to go directly home from the hospital within 3 days of surgery. After your discharge, you may continue your rehabilitation at one of our 5 physical therapy locations throughout central New Jersey.
During your hospital stay, a case manager and social worker will meet with you and your family. We will assist in preparing for your return home with a visiting nurse and a physical therapist. If needed, we can also assist with making arrangements for your transfer to a rehab facility or arrange for in-home nursing care. Our in-house Walgreens pharmacy will fill your prescriptions and bring them to you before you leave the hospital.
I will continue to be a resource for you after your discharge, and I look forward to seeing you at one of our joint surgery reunion dinners.
I'm a nurse at Robert Wood Johnson University Hospital, Somerset. When it was time to have my knee replacement surgery, I knew I would be in good hands in our joint surgery center. Everyone was so caring and helped me manage my pain.
If you have joint pain like I did, don't wait. Before my surgery, I could barely walk and it was hard for me to get around the house. Now I can do practically anything, and it's all thanks to the wonderful team at the Joint Center.